M2020, Management of Oral Medications. Management of oral medications includes the patient's current ability to prepare and take all oral medications reliably and safely, including administration of the correct dosage at the appropriate time intervals. This indicator affects the agency's score in value-based purchasing, and it is important that clinicians understand how to answer this question and what Medicare's intent for this question is. Medication teaching and monitoring should be ongoing and standard for every visit. Clinicians should make a habit of inspecting all medications on each visit, which should assist the patient's recallability. As clinicians, we want our patients to not only have the ability to take all medications appropriately and accurately, but also to have confidence in taking their medications. Medicare's intent for this indicator is simply to identify the patient's ability to take all oral meds. The patient may be more than willing to take their meds, but their ability is lacking. Ensure that you assess the entire aspect of the patient, including the environment and their physical and emotional status. Many factors can limit the patient's ability to safely take PO meds. Factors include the patient's actual physical impairments or cognitive levels, such as memory impairment, impairment in vision, or environmental barriers, which could include access to the kitchen or even medical storage. When assessing this indicator, do not include injectables or IV medications. This does include all over-the-counter medications that the patient is taking as well. Medications given by gastrostomy tube are not considered PO. Only consider oral medications. The time point is at start of care OASIS, resumption of care OASIS, and then again at discharge from agency OASIS. Time points are very important when completing an accurate, comprehensive assessment. It's preferable to observe the patient by having the patient demonstrate how he or she sets up or takes all oral medications. Be sure to assess the cognitive levels of the patient as well as the environment. The strategy of verify, validate, clarify has been successful for clinicians in the home health setting. Step 1. Verify all current medications, including the dose and the frequency. Step 2. Validate. Review medication lists and identify any changes in the dose or discontinued meds. Step 3. Compare the medication list to the physician orders. Keep in mind that if the ability of the patient varies from day to day or medication to medication, document the medication that requires the most assistance for the patient to take correctly. Response 0 reflects that the patient is completely independent in taking all medications at the correct time and the correct dose. This does include all aspects, for example, obtaining and opening the containers and ingesting the medication at the time ordered. Response 1 indicates that the patient requires assistance by another to set up their pill box or to develop a drug diary on their behalf. If the patient requires daily reminders via telephone or in person, select Response 2, even if the patient is independent in taking meds otherwise. This does not include daily reminders provided by a device. If the patient has a PRN prescription on the day of assessment and the patient needed a reminder to take PRN medications, the appropriate response is number 2. Response 3 should be selected if the patient has no cognitive or physical abilities to independently take medications.